single responder Cullen is battling heavy traffic. He's been dispatched to an horrific road accident where a car and motorbike have collided. The motorcyclist is unconscious.
We need to determine whether the unconsciousness is due to a traumatic brain injury or whether he's bleeding from other injuries. This patient sounds critically unwell.
In the last decade, more than 400 motorcyclists have lost their lives on Victorian roads. Thousands more seriously injured.
It's insane, isn't it? We're on lights and silence going 130 and he's weaving past us. We don't want another accident on the way to the one we're already going to. Okay.
Cullen arrives to a confronting scene. Emergency crews are already there. Fuel is spilling dangerously onto the road from the badly smashed motorbike. Multiple paramedics are attempting to save the unconscious rider.
So just to give you a quick handover,
Yep.
GCS 3.
The news is chilling.
The GCS is the Glasgow Coma score, which is a scale between 3 and 15 of the level of consciousness that a patient has. Someone who has a GCS of 15 is conscious, walking around, talking normally. A GCS of 3 is the next step towards death.
His BP was just under 180.
All right. He's lying there motionless, unconscious, which is a sign that he's got a significant brain injury. He also looks like he's got some internal bleeding. And my first thoughts are that this guy has a high chance of dying.
Plan is straight onto the board, onto the bed, into the back.
Yeah.
In Melbourne's outer eastern suburbs, single responder Cullen has been called to a motorcyclist who's fighting for his life.
He's had 50 of fentanyl, 20 of ketamine, still quite agitated.
Yep.
Thrown from his bike after colliding with a car, the critically injured man is now barely conscious and moaning in pain.
Somebody at his shoulders, somebody at his hips. I've got his head. 1, 2, 3, up.
Walk down the side.
Slowly.
Cullen suspects his patient has potentially fatal internal bleeding and a traumatic head injury.
We'll just start moving him into the back of the ambulance. I'm just going to jump in the side.
Loading and going, or?
We're just going to shut the doors,
Have a look.
at the injuries and make a decision, right?
Yep.
When a patient has a traumatic brain injury, we'll often put those patients into an induced coma to protect their brain from any further damage or secondary brain injury. But the drugs we use to do that can make the bleeding internally worse. Is he still extensively tachycardic?
Yeah, so heart rate of 180.
It's a balancing act. If we intubate the patient or put them in an induced coma, it will protect their brain from further injury. But if we do that procedure, it may make the internal bleeding worse.
You didn't want HEMS?
Yeah, absolutely.
Yeah.
In an ideal situation, we'd have the helicopter available. They have bloods for blood transfusion and also have ultrasound to enable the flight paramedic to determine where the internal bleeding is. If they're not in the air...
They estimated 25 minutes.
Yeah,
So I think
yeah.
we're better loading before you're going.
Yeah, let's just get everything stabilised. It's pretty clear that this patient is bleeding to death internally. So we make the decision that we're not going to put the patient into an induced coma and head straight for the trauma hospital. Every minute, every second we're still on scene is time the patient is bleeding to death.
We probably should start going now.
Okay. There's a saying in ambulance that transport is treatment, and this is one of those cases where transport to hospital could be the difference between life and death. Go. Second dose of fentanyl.
Intensive care paramedic Cullen knows time is running out for his patient.
We need to be ready because we may have to rescue tube. We're traumatic head injury, so we're aiming for a blood pressure of 120 here. With this patient, it's not just his brain injury that we're worried about. We're worried about his internal injuries. Let's just have a feel of his chest. Abdo feels tight, okay? Rigid.
Yep.
It's probably bleeding in his gut, I reckon. We can't do anything for internal bleeding. That needs to be fixed in hospital and it needs to be fixed in an operating theatre. So we need to get him to hospital as soon as possible. Sats are dropping at the moment. Heart rate's down to 124. I'm going to give him a bit more ketamine because he's writhing around. What's our location, guys?
As Cullen continues to work on his critical patient, he's starting to piece together exactly what happened.
White car was driving out the driveway.
Yep, and flipped him.
Yeah, didn't see him. So he's gone into the smoke of the vehicle.
Yep.
50 kilometre per hour zone.
Yep.
His helmet was down 20 metres away.
Okay.
The car's pulled out, just basically T-bone.
Yeah.
It's becoming pretty clear that it's amazing that this guy's even alive at all. Every 10 minutes or so, he starts trying to lift his legs again. We just need to keep him semi-sedated, and we're almost about to pull up. That's a good thing because this patient needs to be in surgery 10 minutes ago.
Cullen and the team are hoping they've made it in time.
It's always great when you have a good outcome, but deep down we know that we can't always do that, but we give it our best shot anyway. And it's why I wake up every day, and it's why I love being a Mike and paramedic.
Cullen just got his critically ill patient to hospital in time. The motorcycle rider made a remarkable recovery after emergency surgery.
It never ceases to amaze me that some people survive these things. And what reassures me is that hopefully I've played some small part in that person, A, surviving, but B, having a good quality of life. And those two things are the most important things.
All set in the back end. Take off brake for 05.
Good to go, mate.
Flight paramedic Steve and the air ambulance crew have been urgently dispatched to a road trauma incident on a country road.
A good RV point will be the Kingupna football ground.
Roger, received that, thank you.
We're being dispatched for a young man, a 19-year-old fellow riding a motorbike. From what we believe, he's gone through a stop sign, but he's impacted with a car and has been thrown from the bike and landed heavily. He's got a severely fractured leg as his main injury at this point in time.
How far out are we?
5 minutes.
Excellent.
Unfortunately, with just the way the roads are today, with a lot more cars, we are, as an ambulance service, seeing a lot more motorcycle accidents.
Right, we'll commence the descent.
That's the oval. Very clear on the left.
All right. Welcome to Kingupna.
G'day.
Hey, how are you?
Feel good.
Hey, bud, how are you?
Good.
What's your name, mate?
Kevin.
Kevin? Kevin, I'm Steve.
I can see that the crews on scene that have picked him up from the actual accident site, they've treated what they could with regards to spinal immobilisation, pain relief and IV access, and also splinting of the limb.
What I'm going to do, Kev, I'm going to do a quick ultrasound on your tummy and just make sure you've got no bleeding around your pelvis or around your renal cavities. What do you do with yourself, man?
Look after my son mainly.
Your son, how old's your boy?
2.
How old are you, mate?
19.
Jeepers. Started early. Good work.
Already at 19, he's a father of a little 2-year-old, which is heartwarming to hear that. But it also adds a level of responsibility on my shoulders to think I really need to get this young man to hospital so he can go back and be what the most important role is, and that is father to his little one.
What are you doing riding motorbikes with a son, mate?
Because I was coming up to set up a camping spot.
Oh, were you?
A week.
Yeah.
Yeah.
And what happened today, mate? Just missed the intersection? Didn't see it, or?
No, I didn't see the stop sign on the intersection because I thought it was a railway
Yeah.
and you'd go straight over. I didn't know that there was a stop sign.
This is going to be a little bit of pressure, sort of
Okay.
pointing up in your tummy.
I'm concerned that if I do find some internal bleeding, he could continue to bleed to a point where we will actually require giving blood or administering blood.
Just take a nice big deep breath for me, mate.
So I really need to be thorough with my assessment because I only carry 4 units of blood and we're a long way from hospital.
So you can go here. Sorry, a little bit there. But you can see it's clearly, there's no fluid around there, which is good. And he doesn't have any heart rate or anything suggestive of a bleed.
So now that I've conducted a full assessment of Kevin and I've performed my ultrasound, I can't see any major hemorrhage. However, he could still have sustained a pelvic injury and flying through the air and landing on the road. So just to be on the safe side, I'm applying a pelvic splint.
It's a bit uncomfortable. It'll sort of go over your hips. Have you got undies on or are you freeballing?
Nah, free ball.
Freeballing? Kev, you're living life to the extreme, mate.
Living life, you know.
Living life.
With shorts.
There's ladies here, Kev.
Oh, no.
There's ladies.
There's ladies around.
Freeborn on a motorbike, jeepers. Must be freezing. I think we'll just go over the shorts, actually.
Kevin doesn't have any underpants on, so for Kevin's sake, out of decency to him and to my fellow crew members, I decided to leave his shorts up and just apply the pelvic splint over the top, given the fact that Kevin's decided to go commando.
Just going to pass this underneath you. Don't you wiggle too much.
Yep.
Mate, you got no piercings downstairs?
I hope not.
You hope not.
Yeah.
You'd probably know about it, mate. So just a little bit of pressure around that pelvis, mate. To the side. There we go, popped. Just giving you a little bit more pain relief, mate.
Righto.
And we'll come straight out. Is there anyone that needs to know?
Dad knows.
Dad knows? Yep. Where's he?
He was behind me. The car. Towing a camper trailer.
Oh, okay, yep.
So I saw the car hit Kevin and throw him away. My immediate thought was death. There was no movement. Could have been paralysed, it could have been anything. And I saw the mess of the car. I mean, the whole front of the car was wiped off, it's finished. Big hole in the windscreen where his head went through.
I know.
Well, I went to Kevin and he said, I can't get up, I've got a busted leg. So I had a look. Yeah, she was busted because the bone was sticking out through his skin.
I don't mind. You can't love me, son. Okay.
But I just realised what a close bond he must have with his father,
Thank you.
because I can see Kevin becoming quite teary. So what I see is another side of Kevin at this point in time for a young fella who's just gone through something so traumatic that he has an understanding of the impact that this could have on others. And I think that's just such an amazing thing to see from a 19-year-old man.
He's a good man? You close with your dad?
Thought he thought I was dead.
Oh, understandable, mate. Sounded like a big impact. I'm sure he's very happy to know that you're not. All set in the back, mate.
Okay, we'll lift off here with the middle of the oval and the departure will be to the northwest there, mate.
Kevin fits into a time-critical category because he's got long bone fractures.
150 feet.
There's potential there for circulation issues, and on top of that, there's also potential there for nerve damage. So the quicker we can actually have it stabilised in hospital and assessed, the better outcome it can be. Because the worst-case scenario, Kevin could actually lose his leg, and that would be just absolutely life-shattering for him.
"19-year-old Kevin is being flown to Melbourne with a badly fractured leg."
Hey, Kev, you can hear me, bud? You don't have any other pains anywhere, mate? Chest feels okay? Okay, awesome, mate. You don't feel sick in the tummy?
No.
All right, mate. We'll give you more pain relief.
So now that we're airborne with Kevin, our job doesn't stop. We're always constantly watching any changes in the trends of his heart rate or his blood pressure. If he has a decreasing blood pressure and an increasing heart rate, I'm going to suspect that there's some bleeding that's now active or taking place internally. So we're always just watching that monitor and we're looking out for any signs or any changes.
How's my leg look?
Oh, look, mate, at the moment the colour's good. You know, the toes look fine. Looks like you're getting good circulation to it.
Yep.
But where the actual fractures, mate, it's all bandaged up. So it just depends how complicated the fracture is, if any bones missing or whatnot, as to whether or not you need surgery or just plaster. I don't know, mate, that's up to the specialist down there. But,
Easy enough.
but it's still attached, mate. It still looks like it's got good colour.
Yeah.
So that's amazing.
Easy, thank
Cool,
you.
mate.
Righto, Melbourne.
Only about 2-3 minutes, yeah?
Yeah.
Like any job that we do on HEMS, it's always a relief when the hospital is in sight, especially coming from rural areas. We're in the air, we don't have the availability just to stop on the side of the road. And in Kevin's situation, I'm really comfortable to see that he's actually travelled very, very well, despite the fact that he's still got pain with his leg. He hasn't shown any signs of any hemorrhaging, which is a huge relief.
It's 380.
The Royal Melbourne Hospital, Kevin's going to be met with a trauma team and they'll conduct their own assessment just like I conducted mine. And based on what they find, he'll either go for scans or he'll be sent off for surgery with the orthopaedics team in an attempt to fix his leg. really hope that Kevin gets to go camping with his son and his dad.
And when he does head out for that camping trip, some sage advice.
So Kevin, it pretty much dates back to what my mum always said, make sure you got clean underwear when you go out. He would never have thought this was going to happen, and he would never have thought he was going to have a paramedic standing over him, lecturing him about wearing underpants.
"19-year-old motorbike rider Kevin was hit by a car at speed on a country road after accidentally running a stop sign. At hospital, doctors confirmed Kevin had a nasty compound leg fracture. Surgeons had to dislocate his knee to put rods permanently through his tibia. Kevin spent 3 months in a moon boot.
Now, if I order some more wood to move all this.
Yep.
But he's now getting around nearly as good as new.
Don't know why that's not opening.
He had a broken finger, broken leg, but he was all right. That one there, it's got a dipstick in the transmission there. To the paramedics, all I can say is thanks muchly.
Yeah.
He returned back good. They do their job every day, see these sorts of things every day. They have to be a kind of special sort of person and a very strong sort of person.
Oh, well, we haven't got much to do until we take this out.
Well, pull the boat out.
Easy.
It was a day that neither Kevin or his dad will ever forget.
Should have saw that stop sign. I knew Dad was behind me and, well, I was a little bit concerned for what he just saw. Yeah.
He's my son. I'm his dad.
A frantic call has just come in from the outer southeastern suburbs.
Cars hit a motorbike rider and chunks came off his leg.
Yep, and is he awake?
He's awake.
And is he breathing?
He's breathing.
The air ambulance is required for a rapid response to the accident scene 60 kilometres away.
Is there any blood pouring or spurting out?
It's an open wound. A bone came off, meat came off.
Yeah, okay, just keep him still, keep reassuring him. You're doing really well.
Just clear left. Next right, lifting.
Flight paramedic Ray is on board. He already knows the injured motorcyclist is in a bad way.
So we've been sent to a 21-year-old motorcyclist who's come off his bike at high speed. There's first ambulance crew on scene there saying he's got a compound fracture, so quite a large open fracture of one of his legs.
So I'm just going to go straight in from here. We're on finals now.
The helicopter has been cleared for landing at a local oval near the accident site.
So there's goalposts at either end. It looks like it's cricket pitch in the middle with no fencing around it.
Mobile Intensive Care Ambulance paramedics, also known as MICA, were first on the scene. They've now transported Josh, the 21-year-old motorcyclist, to meet the air ambulance.
Nothing really good comes out of a motorbike v car, and it's generally not very good for the motorcyclist. Good evening all. G'day. I'm Ray.
Sean, this is Josh.
G'day, Josh. Inside the ambulance, Josh is in quite a bit of pain and quite distressed. Now I'm just looking at him going, what are your injuries? It's a bit cold, okay? Just a stethoscope on your chest. Just some deep breaths for me.
Josh can't be airlifted to a trauma centre until he's stabilised. So Ray gets an update on the patient's injuries.
Black eye, as you can see there.
Yeah.
No other bruising or hematomas that I can see. He's had no vomiting or anything.
Okay, all right. You sore in the tummy?
No.
Nothing? Hips?
No. Sorry, mate. I'm just going to expose you for a second. He's got a compound injury to his knee.
Yeah, we might put a bigger bandage on it. Okay, we're just going to cover it and moisten it. That's all we're going to do. So this knee's borne the brunt of the impact. I could see right through into his joint. How comfortable are you, pain-wise?
So much pain.
Yeah, no, that's fine.
See what that can do. You want more morphine drawn up?
Yeah.
Josh is in extreme pain at this point in time. If he could rate it out of 10, he would be a 10.
To relieve Josh's intense pain, he's given another dose of morphine.
Car tried to beat you?
Yeah, in the back of it.
Okay, I'm going to move your arm.
He didn't indicate
Yeah, right.
or anything.
So you hit the back?
Yeah.
Yeah, helmet on?
Yeah.
Leathers?
Yeah, sorry, mate.
Gloves? He's wearing a helmet, fortunately, but that's all he's wearing. He wasn't wearing any leathers, he wasn't wearing any gloves. The tip of one of his fingers is amputated off. Direct consequence of when you hit the ground without gloves. All right, so far, what I'm looking at is a pretty serious compound knee fracture, so an open knee fracture. Josh is in quite a bit of pain with that, so we'll try to get on top of that.
You know, honestly,
Some analgesia.
amputated.
Yeah, knee?
Yeah.
I don't reckon.
You don't?
No, but you know, you're going to need to see an orthopaedic thing. Wiggle your toe for me down there. It looks like he's shattered at least his kneecap, perhaps the underlying bones in it. Josh, see that? Ultrasound probe.
Yeah.
Okay, just lets me look in your tummy. I just want to have a quick look, see if there's any bleeding in there, and then we'll get out of here, okay? This doesn't hurt, it's just a bit cold. We're trying to rule out that the lungs are not working properly. We're trying to rule out that you've got no bleeding around your bladder and your pelvis. If you're bleeding in the abdomen, we want to get you to a trauma centre as quick as we can. Okay, the right kidney looks good, as we expected.
Are you ready for...
Ray, the flight paramedic, has ruled out any internal bleeding, but he's now giving Josh even stronger pain relief for his shattered left knee.
He is now at a point where we can do things in terms of splinting that leg and taking care of it, and he's not really going to feel it. Hands in or hands out? Your call. All right, just need one access to this arm, so this arm's going to have to hang out.
Yeah.
With the pain relief now kicking in, the team can carefully move Josh into the waiting helicopter.
All right, I'm happy to roll. This injury is a significant injury. This is not a week in hospital. This is months. And, you know, the worst case scenario, is he going to end up with a prosthetic joint?
Just in the helicopter now, Josh, okay?
Yeah.
Good lad.
It'll be a 15-minute flight to the trauma centre at the Royal Melbourne Hospital.
Josh, you good?
Yeah.
All right, mate, up in the air soon, okay?
Yeah.
I want you to let me know if that pain starts coming back, okay?
Yeah.
All right, good man. We're in a good spot. We are good to start whenever you are, Tommy.
Great. What do you do, Rog?
Ray's main job now is to keep Josh as comfortable as possible.
So the concentration now, considering we're going to have to move him onto a bed, is to try to get ahead of the curve in terms of where he's going to feel pain. As soon as he starts showing us any increase, we'll deal with that, give him a little bit more, get him over, and then let the docs have a look at him.
Despite his horrific injuries, Josh has a lot to be grateful for. In the last decade, hundreds of motorcyclists have been killed on Victorian roads. Thousands more seriously injured.
Oh, gentle. Being a motorcyclist myself, I can't really say you shouldn't be on them. I love them. But you have an enormous vulnerability to what's out on the road. And you have an enormous capacity to get into trouble. All right, mate. 10 seconds, we'll be off this.
Josh is one of the lucky survivors, but he's about to find out just how serious the long-term consequences of his accident will be.
I'm looking at Josh and he's a 21-year-old bloke, got the world ahead of him. He's got his whole life ahead of him. And now he's going to be walking around with a fake knee, at best.
Five weeks ago, Josh slammed his motorbike into a moving car. The 21-year-old was worried his left leg would be amputated.
I was conscious the whole time. So I remember hitting the car and flying in the air, and then just the impact on the ground was just like a thug.
Josh still has his leg, but it'll take months of intensive rehab to fully recover.
The damage to my left leg's pretty severe. I had like 150-something staples and stuff in it. I had 5 or 6 surgeries on it. So I had the ankle reconstruction, tibia and fibula, I think have rods in them now. I'm not too sure, but I'm pretty sure my kneecap's metal, and my femur had a rod put in it as well, and some screws and plates. And I'd broken a couple of ribs, lost my little finger, and yeah, just hit my head really hard, and that was about it. Yeah, eventually I'll get back on a dirt bike again. I'm not going to let it scare me. But I definitely won't be wearing just a trackies and a jumper next time. I'll be all geared up and properly. Safety first.
Emergency services, tell me exactly what happened.
A motorbike went into a tree that's fallen on the road. He just drove straight into it. And he's been thrown a couple of metres off his bike.
If you go to the left and head down approximately 500 metres.
No worries, Jules.
Intensive care paramedic Al is on his way to what could be a devastating motorbike crash.
Is he conscious? No, not really. He's lying flat on the ground and he's groaning.
Now just make sure that no one does move him unless it is absolutely necessary. We've got some help organised for you.
54 years old, Al is one of Ambulance Victoria's most experienced and respected members.
Country road, 80 to 100k. It's a narrow road, single lane, and it's hemmed in by trees. So no surprise, there's a tree down. Knowing that road, I knew that there was going to be a fair bit of speed involved. So you'd guarantee that he was going to have significant injuries: head, neck, chest, abdominal injuries, fractures, internal bleeding, all those really nasty, nasty injuries.
By the time Al arrives, another crew has moved the accident victim to the safety of their ambulance. After 30 years on the job, Al has seen a lot of carnage on the roads.
It's a big hit. There you go. It's a fair whack.
Yeah, and he's got blood coming out of his ear canal.
What's the gent's name?
Glenn.
G'day, Glenn. Glenn, my name's Al. Where you saw, mate? Whereabouts? Across your chest?
Yeah.
OK. We're just going to cut your clothes off, mate. We just need to get some access to you.
The story is, thrown approximately 3 metres, found unconscious initially, less than 5 minutes. This is the helmet.
Beautiful. We'll keep that in here, eh? Yeah. I've looked at the bike, I've looked at the helmet. Looks like it's got significant damage. I reckon Glenn will have some head injury and potentially a fracture to his skull.
Do you recall what happened, mate?
Glenn's in dire straits at the moment and he needs to get from where we are straight to a major trauma centre ASAP.
Glenn, I just want to feel, you saw here?
No.
OK. Don't move your head, mate. In a moment, we're going to pop a collar on you.
The Canadian tourist has been travelling around Australia on a solo adventure. All was going to plan until he hit a tree on the road and was thrown metres into the air.
Just keep that arm nice and straight for me.
With the huge impact and reports that he was unconscious for several minutes, the air ambulance helicopter is now on the way to airlift Glenn to a major trauma centre.
Just don't move your head around until we get that collar on you, OK?
I think Glenn is most likely to have a major head injury and also other internal injuries. So Glenn is so lucky to be alive and he's certainly not out of danger yet.
How did I end up here?
You hit a tree on the ground, Glenn. It was on the roadside.
With a significant head injury likely, Glenn is now exhibiting worrying signs of confusion.
I'm in Australia?
Here you are.
How did I get in Australia?
You're here, Glenn.
What year is it?
I could hear this repetitive, where am I, what have I done? That can be very suggestive of a significant injury.
I got some institute.
That's all right. You can have the night off.
So I'm really concerned for Glenn's condition. A lot of patients don't survive that sort of trauma.
I didn't do it.
No, you did nothing wrong, Glenn. Nothing wrong at all, mate. You don't have to worry about it. Unfortunately, the tree was obviously down and you didn't see it. Nothing to be sorry about, Glenn.
They need that reassurance. No, mate. No, it wasn't your fault. You know, it's just a really bad accident and you're unlucky for it to happen to you.
In my saddlebags is my plastic.
As Glenn's condition is critical, his daughter Alex is now being alerted back in Canada.
Happy to go, Sarah, when you're ready.
No worries, move off slowly.
Oh, I'm scared.
Yeah, I don't blame you. I'd be a bit scared too, mate.
When I got the phone call, knowing that he was in Australia by himself, obviously that's super scary to even think that someone you care about is in that kind of situation.
I'm just going to score around Australia on my...
On your motorbike? Yeah.
My dad is an ice hockey coach. He loves a good adventure.
We'll be at the helicopter in about 3 minutes.
But when he said he wanted to drive around Australia on his motorcycle, it was a little worrying.
That's how far we go.
It's very unlucky, mate.
Turning in now.
Very unlucky.
It's now just over an hour since Glenn's near-fatal collision.
So we're just going to move around to a better access point.
Thanks.
As the helicopter lands in a nearby hotel car park, every minute counts to get Glenn to the hospital in time.
Glenn could clearly have a major internal hemorrhage that we can't see.
What's my blood pressure?
Blood pressure is about 150, the high number.
And that could be terminal for him. That could be the end.
Glenn, how's your breathing now?
Yeah,
Okay. You're tired? Yeah.
Motorcycle accident victim Glenn is about to be emergency airlifted to the Royal Melbourne Hospital.
Glenn, just arms across your chest, mate.
The 63-year-old Canadian ice hockey coach hit a fallen tree at high speed after an epic 26,000-kilometre adventure around Australia.
How far am I from
Belnary? Oh, you got close. Glenn, unfortunately not quite there.
He nearly made it to his destination, which was only about 5 k's up the road.
1, 2, 3.
And here he is, on that fateful night where he's just struck a tree. And how random is that?
Okay. You're starting to shake a bit and shiver, so... Is that all right, Anna?
Yeah.
Glenn's daughter Alex has been contacted and is arranging a flight from Canada to be at her father's side.
It was always in the back of my mind that something could happen to him while he was on the road.
You're going up?
Yep. And going through this, it was definitely scary. Definitely a bit of a realization of how precious life is and how quick it goes.
With a suspected fractured skull and life-threatening internal bleeding, Glenn's future now hangs in the balance.
So for Glenn, there's a real chance he won't survive his injuries.
It's a fair whack.
Yeah, and he's got blood coming from his ear canal.
It's been 3 months since motorcyclist Glenn collided with a fallen tree on the road at the end of his dream holiday adventure around Australia. The 63-year-old Canadian ice hockey coach was airlifted to hospital with critical injuries, including a fractured skull, a collapsed lung, multiple fractured ribs, and a broken collarbone.
You're fighting for life. Like, you can't breathe, you got tubes all out of you, and everything hurts, your head, your brain's not working. I look at it as I'm fortunate that I'm here. I'm fortunate to survive. It's minus 30 where you came from, just to look after me.
Today, Glenn's out of hospital for the first time.
Thank you, Lord, I'm alive.
I'm super happy that you were given a second chance because I don't know what I would do without you.
Daughter Alex, who immediately rushed to Melbourne, has been by her father's side throughout his long recovery.
I know it is a tough way to get my daughter to Australia.
For him, alive and getting better, it's definitely, I'm so thankful for that. His accident was a bit humanizing because, Superman thinks or realizes he's a human and that he's maybe not 35 anymore. You want me to cut that asparagus for him?
Yeah, that'd be great. When Alex arrived, it was a godsend. It was really emotional and heartfelt. She's been absolutely fantastic. An angel. Thanks for coming down because I needed the help.
Of course.
I really appreciate it.
There's a motorcyclist come around the bend and went off the road and hit the ditch and...
Okay.
At the moment he's pretty smashed up.
At the state's Emergency Communications Centre, a call for help has come in from the scene of a motorcycle crash 200 kilometres away in the Victorian High Country. Intensive care flight paramedic Matt is now on the way with an air ambulance crew to rescue the motorcyclist.
Fully departure, maintain upwind till advised, please take off. Airspeed's alive, admitted.
Okay, is he awake?
What, he's awake, yeah?
Yeah, okay.
He looks in a bad way, though.
We'll keep the helmet on, okay?
Maybe leave the helmet on. Leave the helmet on.
Yeah.
Don't do it. Yeah, just loosen it.
The accident victim reportedly has a collapsed lung and is in danger of going into respiratory arrest.
We suspect that perhaps a broken rib has punctured the covering of his lung, allowing air to come in around his lung. And the only way to relieve that is by putting a hole into the chest to allow that built-up pressure to escape. If you don't allow that to happen, that person will go on and die.
Dust everywhere.
The helicopter is landing at Mansfield Airport, where the road crew is waiting with their critically ill patient for Matt to take charge of the situation.
On the ground, farm 0.
What's going on? So I've got Gavin here, he's 57. Gavin was riding a motorcycle approximately 80 kilometres an hour. I failed to negotiate a bend.
Gavin was taking part in a charity ride when he lost control of his bike and crashed into rocks. His son Billy was travelling ahead of him at the time of the accident.
When I rocked up to the scene, I seen his bike upside down in the ditch, and it was, I didn't know if he was dead or alive. I was just telling him it's going to be all right. The ambos are on their way. Yeah, it was just a horrible feeling. Horrible.
Got a pelvic wrap on? Pelvic wrap on. Gavin, give your toes a wriggle for me, mate. Good man.
Miraculously, Gavin is showing few signs of external injuries due to his full leathers and helmet. But internal injuries are now threatening his life. A suspected collapsed lung is Matt's first priority.
Gavin, how you going, mate?
Pretty better.
Yeah. Mate, your oxygen levels are pretty low. I'm concerned you've collapsed your lung, which is why they put that needle into your chest, but it's not doing a great deal for you at the moment, mate. So we're going to try and give you a bit more pain relief and see how you go with that and see if we can get you to breathe better. And if you can't, I'm going to have to put you to sleep so we can take over your breathing and get you back to Melbourne, mate. Sound reasonable?
You're the boss.
Righto.
Gavin is very sick. He's got a really fast heart rate. He's got a really fast respiratory rate. His oxygen levels are very, very low, and his blood pressure's low as well.
Nice big best for me, Gavin. You're doing really well, mate. We'll give another 20 of ketamine, please. I can do that.
So I'll attempt to do a needle decompression on Gavin first, and if I don't get the results that I want from that, then I'm going to be forced to take more drastic action.
So sharp out, guys. Sharp coming out.
Back in the Victorian High Country, motorcycle accident victim Gavin is in a serious condition with a collapsed lung.
Gavin! 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 Open your eyes. Good man, good man.
Using a decompression needle, Matt has attempted to release a life-threatening build-up of air from inside Gavin's chest cavity.
Righto, so ketamine's kicking in, sats are up to 84.
Still got a rest rate 60.
Yeah.
But the procedure has made little difference. So Matt now has no choice but to try and put Gavin into a coma and take over his breathing entirely.
Gavin, I'm going to give you some medicine very soon. It's going to make you very sleepy. Your oxygen levels are still very low, so we're going to put that little tube into your mouth and we're going to fly you back to Melbourne in a moment, okay?
There is so many factors that make this difficult. I know that as soon as I take the mask off and he stopped breathing for himself, his oxygen levels are going to rapidly deteriorate, which could lead into cardiac arrest. So we've got to perform this procedure as quickly as possible.
Just lifting you up, bud. Sorry, bud.
Yeah, you're all right. Okay, I have the ketamine.
Yep.
So 2 mils, 20 milligrams. 1, 2.
Is everybody ready?
Yeah, we're ready to go. Fine.
If I don't get it right at this point, you know, the consequences are going to be dire. So we need to get it right first time. Just get ready.
That ketamine's on board.
Just turn that suction on and have it available for me, please.
Yeah, sure.
Up in the remote Victorian high country, flight paramedic Matt is trying to save his critically ill patient after an horrific motorcycle crash.
Righto, guys, so this is the plan. He has got oxygen sats at 74% at the moment, which is very low, obviously. So it'll be a one look. If I don't get a view straight away and he starts to desaturate very quickly, I'll pull out early and we'll go straight back to back valve mask ventilation. Is everybody ready?
With oxygen levels still too low, Matt puts Gavin into an induced coma and takes over his breathing.
Saturation still holding.
Gavin's wife Sharon had been waiting at the charity ride finish line when she heard the news.
I'd been told that he'd been put in a coma, but I didn't know the extent of his injuries. It was bad. It was bad. We've been together for 30 years. He's my soulmate, I suppose. Yeah, he's my best friend.
We've got sats at 74 at this stage.
So there's a build-up of pressure from both air and also blood inside his chest there.
Gavin is still not responding to treatment, and time is now critical. With hospital 30 minutes away by helicopter, Matt has no choice but to carry out one of the most risky procedures that can be performed by paramedics in the field.
Now, he is likely going to tension with us doing this, so I would like to move fairly swiftly.
Pulse.
So the next thing that we need to do is what's called a finger thoracostomy, which is an invasive procedure where we make an incision into the side of the patient's chest so that any pressure that's built up inside surrounding the lung can escape out of the patient's chest. So sharp out, guys.
Sharp out.
He's a big boy, so locating his ribs can sometimes be quite hard, so we've got a fair bit of tissue to cut through. It's a fair way in.
Yeah, we'll just wait until Matt's
There you go. There's your hemothorax. Yep.
The blood and air have been released from Gavin's chest. Now the team must wait to see if his oxygen levels have improved enough to get him into the helicopter.
There's definitely air coming out with each breath there. The bleeding seems to be slowing down as well, which is good. Righto, sats are 93. Can we have a unit of blood, please, mate?
Push this in.
The oxygen levels have improved, but Gavin's low blood pressure is now the problem.
Let's get that blood up and going. Get a 12-lead ECG, make sure we're not missing anything. I'm very concerned about Gavin. I've taken him from a high conscious state and I've put him to sleep. I've cut a hole in his chest, I've let air out, I've let blood out. I'm still very concerned for him. His blood pressure's low, his heart rate's fast, he's bleeding somewhere else, so what he needs is to be moving towards a hospital. Let's get him across and get him sorted. He needs to get to Melbourne. Now, I'm not putting a collar back on, but we are all aware that he's got potential for cervical spine injury. This should keep his head nice and in alignment. All right, guys, someone needs to hang on to the blood and someone needs to take control of the monitor.
At the Mansfield Airport, flight paramedic Matt is satisfied his critically ill patient Gavin is stable enough for the 30-minute helicopter trip to Melbourne's Alfred Hospital.
You right to go? Yep. He's still critically unwell at this point, and so I don't want to hang around at scene. The patient needs to be in hospital with surgeons standing over the top of him. Can I just get someone to be in charge of squeezing this blood for me, please?
As well as a collapsed lung, Gavin's blood pressure is dangerously low.
Let's get him in and get him on the ventilator.
Matt also suspects the 57-year-old could be bleeding internally from his high-speed motorcycle crash.
So we need to get the fudge out of him. He's been here too long now. We just need to squeeze that blood into him as much as we can for the moment. Keep an eye on his SpO2, keep an eye on his blood pressure.
Squeeze that in. We want to try and get that BP sorted. Low as possible, please, on the way back. Cool.
The helicopter needs to stay at a low altitude to prevent any further pressure build-up inside Gavin's chest.
I still have no lung inflation on this side. I cannot feel his lung.
This is a physically and mentally exhausting job. I've made decision after decision after decision with this patient at this stage, and so my brain is going at 1,000 miles an hour. He's still very, very unwell. He's still in a uncontrolled environment in the inside of the helicopter. You know, he still has the potential for things to go wrong with him.
Not like what his BP's doing again at the moment. There are 150 coming down.
When we talk about what I enjoy in this job, I enjoy going to work and helping people when they really need it.
Thanks, guys. Thank you.
So when we land at the Alfred and I can see the medical staff and the medical team come to assist me and to take over care of the patient, it is a big sigh of relief.
Hi, how are you going?
How much time does he have?
Is that 4 units now? Yep.
We've worked really hard with this patient for the time that we've had him, but it is also nice to be able to hand over to an emergency department where they've got 20, 30 people that are standing around to help him and assist him.
But the battle to save Gavin is a long way from over. His life is now in the hands of the Alfred Trauma Team. 6 weeks ago, 57-year-old Gavin was fighting for his life after crashing his motorbike. The injury toll included 14 broken ribs, a fractured collarbone, and a pelvis smashed in 4 places. Emergency surgery on a collapsed lung got him to hospital alive. But Gavin's wife, Sharon, and sons, Jack and Billy, are still coming to terms with just how close they came to losing him.
They grabbed her and Jack and Billy and took them in the room and said, "This is 50-50.
When the doctor said that it's touch and go because he's so broken, I just thought, what am I going to do without him? Life won't be the same. That's what I was thinking.
Yeah, it's hard for them. But I'm here to tell the story. I don't usually cry. I'll be right when I get home.
Oh, I better make the most of it then, eh?
She's got a fair bit. She's got to learn how to wipe my bum.
Oh, no, thanks.
Chop my food up.
It'll be at least another 2 months before Gavin can attempt to walk again. As for getting back on a motorcycle, no decision has been made yet.
I've got 12 months or so to think about it anyway.
Exactly right.
He came through. He did. He's a fighter. And he's still fighting, but yeah, he'll make it.